Well, and if you consider that this show at the core is about freedom, and for me, one of the best ways to have freedom is to be financially free, to have economic freedom on these types of things. And going back to your points on medical bankruptcy, that's the opposite. So you eat bad food, you have high costs, you go bankrupt. Now they've taken away your freedom of mobility, your freedom to provide for your family, your freedom to
Mhm.
walk away from possibly a job which doesn't align with your values or makes you want to participate in things that you don't philosophically agree in. So it is a downward spiral in a lot of these types of things. And that's the opposite of what we're looking for. We're looking for an upward spiral and providing people with real life solutions on how they can have freedom in their life. Now, my wife is from mainland China, and
Yeah,
looking at
absolutely.
things from a an Asian perspective, which is we speak Mandarin in the house. Like my kids all speak Mandarin, and my wife speaks Mandarin, and you know we kind of look at the body as a whole, as a complete system. Now, I think Western medicine does a phenomenal job at like
Mm.
trauma, like treating trauma, Western medicine, Western styles, fantastic, amazing. But I'd say overall health, they're really lacking in a lot of ways, and a lot of the society is built, as we're discussing, not in a way that you're going to be healthy, but in a way that you're going to be unhealthy.
Yeah. Yeah, I totally agree with that. I mean, I think that what you're saying is let's get to root cause here as opposed to just treating symptoms. And I think from what I've seen is Western medicine treats symptoms. You go into the doctor, you tell them what's wrong, the doctor gives you a medication. And that is just treating the symptom of an underlying problem. From what I've seen in Western medicine and some of the naturopathic, holistic, functional medicine groups here in the United States is let's look at root cause. Let's figure out what is going on with your body as opposed to just treating the symptom. Because if you treat the symptom is going to come back. If the symptom does come back, I now have a human being that's a source of recurring revenue for me. It's just more profitable to have somebody with recurring symptoms because they got to keep coming back. They got to come back for more doctor visits. They have to come back for more pharmaceuticals. They have to come back for more prescriptions. They have to come back, and it's a recurring revenue cycle that everybody wants in their business. If I find root cause, they may never come back. That's bad for my business. If I'm one of those doctors. It's actually good for my business, but bad for a doctor who doesn't have that recurring revenue. And so that's again one of the perverse challenges within our system. And I think that the more times that you can pay for something, directly, so it's coming from you, you then have an incentive to reduce that cost. You have an incentive to look for the root cause. You have an incentive not to go back to the doctor's office, not because it just costs a lot more money, but because nobody likes going back to the doctor over and over and over again and feeling like crap every single day. And so now I have an incentive to go and really try to figure out the root cause. And so we need a lot more root cause medicine, which I think Eastern medicine is significantly better than Western medicine at figuring out.
100%. I mean, the holy grail of business is continuity. If you can have continuity in your business, recurring payments, that's fantastic. I do it in my business. We've got a
Mhm.
membership program. It's called the Hub. It's $2,000 a year, but you know what you're paying for. Like there's nothing sneaky in there. We provide as much value as humanly
Right.
possible to you. So at the end of the year, when it comes up to auto billing, you're happy to pay that money because you feel like you've gotten way more for it. With what we're describing here with Western medicine and a lot of the healthcare, quote unquote, is it's very sneaky. It's very sinister. A lot of the way that things are set up, and exactly how you're explaining on the incentive programs, how doctors are incentivized and how the hospitals are incentivized and the insurance companies are incentivized. It's not necessarily your best interest at heart. And don't get me wrong, like I love my doctors. I would say probably a quarter of all of my private clients for my company are doctors. And they also realize that a lot of the things are broken in the system and a lot of them just don't want to participate anymore. I have doctors now who are 48, 49, 50 years old who are doing early retirement. And they're like, you know what? I don't want to deal with the insurance companies anymore. We take their nest egg, we move it overseas, we diversify it into cash flowing assets, and cost of living is a half, a quarter, a fifth of what it is back home. And
Yeah.
it's just like, go and enjoy your life and don't have all these stresses. And when you think about the chance of being sued in the United States, in the most litigious country in the world, for doing something as a doctor, it's a rough deal. I mean, it's not like it used to be. Um, before. So I don't know. It's a
Yeah.
difficult situation. I think a lot of people are in.
It is, and anytime you consume a good or a service that you don't pay for directly, so a third party pays for, and in our case, an insurance company, there is just an inevitable consequence of that that you're going to consume more, right? Like if I'm, go to the car dealership and I can get an entry level, sedan versus a, souped up SUV, and I don't have to pay for it. I'm going with the souped up SUV if I'm not paying for it. If I'm paying for it, I'm going with the entry level sedan. So we just have a consumption issue that is fueled by, somebody else paying the bill. And so, that again is a reason to make, personal responsibility a greater part of the healthcare equation, because I think that leads to, better health, lower cost, consumption goes down for a variety of reasons.
Okay, so before we get into the solution, which I'm super excited to understand what you figured out as a solution, I just want to kind of understand, if we don't do anything, are things just going to magically get better on their own? Or is the trend actually getting more positive? Is it getting more negative? What is the direction in the United States right now?
Yeah, I mean, I think we're going in a tough direction. We talked about, I think the big companies, own a lot of our legislators. I don't think we're going to get any laws that are passed that are going to significantly impact this. I think that private equity is also playing a much, much larger role in our healthcare system. So, for example, something like 80% of doctors were independent a decade ago. An independent doctor means they have their own practice. It's now down to 20%. So it's gone from 80% to 20% over the last decade. And so why has that been? These local hospital systems are gobbling up all these local practices so that you are now a part of their system. And you no longer have, or very few, the local family doctor who's on their own, who's not influenced by the big hospital system, because once you're in the big hospital system, it's hard to get out of that. So they're employed by a hospital system. They're going to want you to go to this hospital. They're going to want to get you your labs done here, and that's hospital owned. They're going to want you to do your imaging here, and that's hospital owned. And anytime you go to a hospital based service provider, they are at least 3 times more expensive than an independent. So that is a massive, massive problem. Once I did a little video where I was sitting in the airport, and so maybe you have expats, you have people all over the place, who get this. You walk into the airport and you buy a bottle of water. In the United States, you can go to buy a bottle of water in the airport for $5, right? If you get a bottle of water outside of the airport in the grocery store, it's about $1. Right. So why are you paying $5 for a bottle of water in the airport? Well, you're trapped. Right. You can't get bottled water from anywhere else. The hospital systems do the exact same thing. If you get a service within that hospital system, it's 2, 3, sometimes 4 times more expensive than if you were outside of the hospital system, because they try to trap you in that system and make it very difficult for you to get out. So one of the things that, people are listening to this in the United States and maybe even other places, go try to find independent doctors. That's the number one way that we have found to reduce costs. These are doctors that are free from the perverse incentives of big hospital systems. They're on their own, just trying to make a living. It's between you and them. Man, it's a beautiful thing if you can find that doctor. Sounds like you've got some of those doctors down in Panama. If you're listening to this in the United States, find that independent doctor, call them up, ask them, are you independent, or are you a part of the local hospital system? If they say independent, then more than likely you have an independent thinking, think outside the box, root cause, focused type of doctor. That would be my big suggestion.